This man is happy. It shows in the way he pulls off the Karamajong dance. He's thanking God that he has begun the new year 2014 with negligible problems and good health.
It's the one who passed on. Just of recent.
Ironically, he dances near a grave of a woman who died mid-November 2013 because of ill health. Everyone around this Lokwaka homestead, where this man dances, is afflicted by what killed 29-year-old Margaret. Hepatitis E, a disease which if neglected can destroy the liver and cause death.
Yellowing of eyes, abdominal discomfort. Yesterday arrived at Iriiri center with continuous confusion.
She was about to produce, she was 8 months. We took her to maternal hospital. She was referred to maternal hospital. So from there it was known that it is hepatitis E.
The disease man faced its symptoms in Margaret's husband as well.
He saw us neighbors also were falling sick. They were eating a lot of pawpaws and drinking pawpaw roots and too much sugar. So he also thought that would be the alternative. He also had to give the woman.
His wife took long before she sought treatment in hospital like other residents in Iriiri sub-county. Our first stop before we get to Napak town. The Napak District Health Officer, whom we caught on his way off work this evening, told us that this is commonplace.
There was a lag in trying to realize that we were having a serious problem in the community because most of the patients actually never came to the health facilities because they think that treating yellow eyes can better be managed at home with the herbal concoctions. Most of the patients here are using pawpaw roots. They cook raw pawpaw fruits. They take roots of the neem tree.
Iriiri, where we stopped for the evening from Kampala, is the 5th most afflicted of the 7 sub-counties in the district.
In most of our health facilities, we were seeing an increase in the number of patients coming to seek for health services.
Because most of the patients were growing yellowish eyes and passing yellow urine. And the medical doctors told us that this is hepatitis E.
There was a shortage of test kits. Actually, there were no test kits at the Uganda Virus Research Institute initially. So we just kept sending samples there until actually November is when we were able to confirm that indeed this was hepatitis E.
The residents in Iriiri admit to getting alerts on hepatitis E since May 2013 when the district became aware of the outbreak.
We have heard about hepatitis E. We should be really drinking clean water from the bowl, not just water from the streams and so on. And then we heard about hepatitis E. Also these drinks, called the drinks here. It causes hepatitis, and at least we should take these drinks of water. That is the one we call majimoto with water, because and then we should be also very clean. Also, people who are selling drinks.
We've been trying to get them to clean up. Pay attention to sanitation, really.
Yeah, we have tried. There's a bit slight change because on latrine coverage it has a bit risen. People have started digging latrines around. It's now only this vending that we are still trying to campaign so that they reduce this open air selling of food stuffs.
Most of the community is relying on water ponds, from the water runoffs. And they share this with animals, and this is really a big problem in communities which practice open defecation and that kind of thing. So it becomes a serious hazard to the community.
In Iriiri sub-county, the first victim to hepatitis E lies here. Margaret was the mother of 2, expecting her 3rd child. However, she died because hepatitis mostly claims women who are pregnant. Now the family has learned something from her death and they have taken up measures To see to it that none of them gets hepatitis E, the first has been to start with constructing a new latrine, something they didn't have. Her death has gotten them to learn some lessons about this disease.
So far, 15 people have died, 13 in 2013 and 2 more in early January. Surveillance continues for more deaths.
10 of the dead are pregnant mothers, which is a very, very unfortunate thing. In fact, because of this outbreak, our maternal death risk this year is really much higher than the usual expected maternal death risk.
This Thursday, the Minister of Health will meet up with the district health team to discuss more about the burden of disease as the numbers of those affected continue to rise. Florence Naluyimba, NTV, Napak District in Karamoja.